what do you do when a patient comes in and wants the wrong treatment? Yesterday, I had a patient that comes into my office. She's from Romania. She came in with her husband. She was very nervous. She was talking and talking and talking. She had a very complicated medical history. Her teeth were falling out. She couldn't bite down. She goes, I want this tooth out because I'm going to Romania in a few weeks. I need to have a flipper before I go. This was my first visit with the patient. She's telling me what to do. I looked at her. I said, okay, we can do that. So I never say I can't do anything. I always say, yes, of course we can do that. I may not do it, but I always tell patients I can do it. Why? Because I don't want to have any resistance when I meet a patient. And plus, I don't even know her. And she may change what she wants to do once she's educated. So I said to her, I said, listen, what do you want? She goes, I'm in pain. She goes, don't come near me, I have bad breath. Well, she has severe periodontal disease. She had about 12 teeth left, and they all had about class 2 and 3 mobility. They were depressible. She couldn't eat. She couldn't bite into a sandwich. They were not very aesthetic. So she had a functional problem. She had pain in her mouth. She had infection. She had bleeding. She didn't feel really good. And aesthetically, she didn't like the way she looked. Her history was somewhat complicated. She had had a couple of strokes. She had an ankle that had just fractured. She had idiopathic thrombocytopenia. She had a number of medical problems as well. I said, don't worry, we can talk to your physician about that. We'll make sure it's okay. And I spent about 45 minutes with her and her husband. She started yelling at her husband in the middle of the treatment, which was something that I see a lot. And I turned to her, I go, don't yell at him. He's here holding your pocketbook. He's being nice to you. She goes, no, I'm just nervous. I'm just nervous. And then he looked at me and I go, that's just guy code. I'm just trying to make you comfortable. So I realized when you have both patients in a room, you got the husband and you got the wife, you got to make sure that everyone's comfortable in that room. So I include them both in the conversation. I said, do you mind if I take a few minutes just explaining what some options are? And I didn't bring out any slides. I didn't bring out any x-rays. I just started to talk to her about different things that can be done. I said, we can do implants. We can do a partial. We can do an extraction. I can make a flipper before you go. I can make a little temporary bridge. And I started explaining all the different options that are available to her without giving her a treatment plan. So the husband turns to me and goes, how much? I go, I don't know how much. I said, first of all, we don't have a treatment plan. I'm not sure what the best thing is to do for you, but I will get you comfortable before you go on your vacation to Romania. He goes, well, what should we do? I said, I'm not sure. I go, let me do this. Let me go through all the different options for you. I'll send you a letter, which I always do to my patients. I give them a 3-page letter in her case to go through different options. And I'll refer you to a restorative dentist with whom I work. I go, and the two of us will then talk with you and then come up with an option. He goes, well, we're leaving in 6 weeks. I guess it's not a problem. I have my staff, my teammate, go to the front desk. We call the other office, make an appointment. She's seeing him today. So within the first 24 hours of me meeting this patient, I gave them a whole series of options, and I made sure that they were into the restorative dentist's office so we can go through a plan. When I finished going over all this with the patient, she started to cry. And I looked at her and I said, are you okay? I knew she was okay. I knew what the tears were. In every room in our office, we have tissue boxes, as many of you may know. So when patients cry, we can immediately hand them a tissue. She started to cry and she looked at me. She goes, thank you so much. I go, for what? Now, what I didn't know was I was the 5th dentist she had seen, the 5th surgeon she had seen in the last 2 months. She was looking for someone to talk to her. She found me on the web. Finding me on the web doesn't mean anything. Maybe you do a little research, you see I teach, I publish some articles, but you don't know what kind of doctor I am. You'll never know what kind of person I am until you meet me one-on-one. And it's a one-on-one experience. You have to, or I have to, connect with my patients to make them feel comfortable about who they are. I look into the eyes of my patients and I see a human being there. I don't see a full mouth reconstruction. I see a human being that has not had somebody to be able to explain to them what the options are for them. As a patient myself, I know what that's like. As a person myself, I know what it's like when I'm in a situation where I need a lawyer, a financial analyst, or a chef, or somebody who has some expertise in a field that I don't have, that has to be there for me so they can do the right thing for me. So as she cried, she stood up and she says, can I give you a hug? And this earlier, she didn't want to get near me because of her bad periodontal disease breath. I said, sure, you can. She gave me a hug. She goes, thank you so much. I've seen 5 doctors and you're the first one that spent any time with me. And then I asked a question because I was sort of curious. I didn't ask her who she saw. I go, tell me about your experience in the other offices. How much time did they spend with you and did they give you a treatment plan? Now, I haven't given her treatment plan, but I have spent 45 minutes with her. We took an x-ray. So I had a cone beam CT scan, and I had 45 minutes with her and her husband and my assistant. They looked at me quickly. They told me I need to lose all my teeth, and they gave me a computer printout, and they handed it to me, and they said, this is what I need to have done. I go, how long was the visit? They go, maybe 10 minutes. I go, did they explain what they were going to do? She said, no. So she didn't feel the connection. Now, a lot of people say to me, Mike, you spend way too much time talking to your patients. Well, maybe I do, but about half my day is spent talking and half my day is spent treating. So I look at myself as being two types of people. One, I'm an educator, not educating a dentist, but educating my patients. And two, I'm a carpenter or a surgeon. I do the treatment once they're educated. Patients don't know what they need. We have to educate them, and we have to spend the time connecting to them with education and compassion and love and respect. We have to be there. If you slow down and take the time to be there with your patients, I guarantee you your case acceptance will soar, and the joy of practice will come back if you don't have it, because most dentists, most physicians would have done something else. They look back in their career. Me, I wouldn't trade this career for the world. I have loved treating patients for these last 40 years. I still love it. It still gives me so much juice because I'm able to be there for patients. And the old prayer, you get more by giving than receiving. The prayer of St. Francis of Assisi. Well, I believe that's true. It's almost selfish to give, which is ironic. And a lot of the concepts of life are ironic. So by being there and to give to my patients, I get so much more. And this patient will be back and we'll be doing a full mouth rehabilitation either before she goes to Romania or when she comes back. But I make sure that when she goes to Romania, she's comfortable and she has a nice smile. So spend the time with your patients. It's the greatest gift you can give them. I hope you have a great day.